to the dorsum. Voilà. So I was on the right side, I moved to the left side. Maybe we can stay on camera. Okay, maybe camera 1 just to show you where I put the needle. And then we move to camera 2. Alors, one trick is, you fermez vos yeux, pinch the skin, so to distract the attention from the patient. You go down to the bone. Okay, and now camera 2. Okay, tournez un petit peu. Voilà, normally, of course, I don't turn the head of my patient. Okay, ça va? Okay. So here is 0.2 ml that remain in my syringe. Voilà. There is a little depression here, so I move from there. Ça fait mal. Because I was too fast and I didn't inject. Voilà. Camera 1, I want to see the front view. What is important also is not to over-inject here and not to get the gel falling down here. And you had an injection a year ago or two, and the gel came down here. Okay, so we don't know which gel, but and we don't tell which gel, by the way. Vous pouvez me tenir ça et rester là, s'il vous plaît. So now I do a molding. You see my fingers, I create, camera 1, I create this shape, it's like a rectangle, because I want to shape that. Zoomez un petit peu, s'il vous plaît. Voilà. 2 fingers lateral, 1 medial. It's like a rectangle. And I want to just create this tiny projection here. And now, because this is like a normal life, I don't want to inject 2 or 3 syringes on her nose. I have this 0.1 ml. What do you think? Shall I inject? Attendez. Shall I inject on the supra-tip or more on the dorsum? Caméra 2, pardon. Je vais tourner la tête comme un malade. I think the nasofrontal angle and the dorsum is smooth enough. Zoomez un petit peu. Voilà, I think she needs a little bit. We like on surgery, we like this, what we call the double break. This is one break and a double break, but I think she needs something here. Regardez, le nez vous plaît ou vous voulez que je corrige un peu ce petit creux-là? Voilà, okay, so I ask the patient. Voilà. Of course, surgeon, we are God, but God listen to, comment se dit, à ses ouailles, hein, to the believers. Voilà. So, camera 1, just to show, tournez la tête, excusez-moi, vers là, vers moi. Attends. Okay. And this is 0.1. So here I'm not that deep, I'm subdermal. Voilà, because she said because I'm more subdermal. I don't need to go too deep there. Voilà. And what is important, you look at the color of the skin, and you look when it's a bit painful. Of course, you have to stop. And the severe pain with bleaching, you stop immediately, and you use hyaluronidase. No choice. You don't think. You just use. I have a hyaluronidase in my office, in the fridge, ready. And mixed. Alors, faites voir le profil là. Okay. So now I do a bit of molding.
Yes, it's great, Hervé. Very
voilà.
nice.
Okay. So, on the front view.
You have to imagine it. We make this only with one syringe, which is really a case that happens every day in our office. Because, as you say, to do face with 10 syringe, it's very easy in a workshop,
yeah,
but
sure.
it doesn't happen at the office.
Or 20 or 25, I will see sometime. Huh?
But at the office, it's not every day, unfortunately.
No. So what this is a trick we use also in surgery. After the rhinoplasty, we use some water, and you see roughly the two aesthetic lines, and that the nose looks straight, okay, and balanced. So we turn, camera 2, okay, voilà. So that's what I will stop there. I will tell her to come in a month. Maybe she need a little bit of more injection here or a little bit of more injection here. Mm-hmm. So this is for a budget of one syringe.